Hello, my name's Rebecca Davis. I'm the Dermatology Nurse Consultant for University College Hospital London NHS Trust. Today I'm going to talk to you about how I would do a skin examination for someone who has a skin problem. Prior to examining the skin, I would always take a medical history from the patient and then a dermatological history. So I would ask the patient to start off telling me what the problem is in their own words, and then ask other things such as what their main problem is, when and where the problem started, has it changed in appearance, how long has it been present, has it got better, and if it did get better, what helped it to become better, where did they first notice the problem on their skin, have they travelled recently, have they taken any medications, do they have a family history of skin cancer or atopy, and do they have any fears or anxieties about their problem. I would also consider doing a psychological assessment and would usually use the Dermatology Life Quality Index. For an examination, it's important to have a warm private room and for the patient to feel welcome and reassured. A good light source is important, and also a magnifying glass with a light can be very helpful. It's poor practice to just examine the one area that the patient has shown to you. It's important to examine the whole of the patient's skin so that you can be sure of the diagnosis. So the patient is undressed and ready for examination on the couch. When you're examining the skin, it's important to also consider the other systems, because skin conditions can sometimes be a sign of systemic conditions as well. So always bear that in mind during your examination. So we'd start with the examination of the nails, and what you're looking for is any pitting or any hyperkeratosis of the nails, any changes at all. And from there we look at the skin on the hands, both sides, looking at the palms and the dorsum. Would you mind just slipping your arm out of your gown now? Thank you. So if you just pull that arm through, that's lovely. Just the one is fine. So as you look, you're looking for any lesions, whether they're generalised or grouped or solitary lesions. You're looking all sides and also touching the skin to feel the warmth, cold, whether there's any weeping, crusting. Thank you. From there we're looking to the scalp. If someone has longer hair, you'd part the hair and then look through, looking for any signs of thinning of the hair, any scaling or redness on the scalp, any patches of baldness, or if the hair is, can you just bend your head forward? Thank you. If the hair is weak and breaking off. From there we look at your face, and you're looking for any lesions. There's a solitary lesion. If you can shut your eyes. Thank you. And then if you can open your mouth. That's lovely. And with the light. Sorry, it's a bit bright. If you want to shut your eyes, that's fine. Looking into the mouth, if you could stick your tongue out. That's lovely, thank you. So now I would look at the toes and the nails, and again we'd be looking for similar signs in the nails of discoloration, pitting, and look at the soles of the feet for any lesions on the soles, any thickening, and always between the toes looking for any pigmented lesions between the toes. And then working the way up the legs, looking again for any lesions, any changes in the colour. Excuse me, if I just bring this up, is that okay? Thank you. And any different pigmented lesions. So you're looking at, to describe the shapes, whether they're, what the colour is, any changes in colour. You would also look for the shape, whether it's annular, so it's ring-shaped, or if it's linear, if it's in a line. Okay, that's everything, thank you. So then to examine the back, either get the patient to lie on the couch or to stand up, and again look for the same signs, taking note whether things are symmetrical or asymmetrical. Then ask the patient whether or not they have any involvement in the genital area and examine that area too if required. Okay, so that's the end of the modified skin examination. Remember when you're examining the patient to always feel the skin, feel the lesions, whether they're scaly, thickened, and describe those, what you feel on a body map and on their notes. Locate the areas that you found the lesions onto the body map. Then consider whether there's any further investigations that you need to order, blood tests, swabs for virology or bacterial swabs, scrapings for mycology if you're wondering whether it's a tinea infection, a diagnostic biopsy if you've noted a pigmented lesion that perhaps might need dermatoscopy or a diagnostic biopsy. I hope that you've enjoyed watching this skin examination and that you've found it useful. I will have some references at the end for further information for you. Thank you.